Hello, thank you for joining me today. My name is Adina, physical therapist, and we're going to be talking about treatment options for muscle and joint pain. And the purpose of these presentations are to just, for some of you, to introduce some of the options that are out there. Others, you might be familiar with it, but maybe have some questions about it. But these are opinions of myself as a physical therapist, and it's based upon my experience or my observation. And so hopefully you'll take away a few points to help you to make some decisions about what you can do for joint and muscle pain. Now, most of us are familiar with the concepts of needling, but the most popular that's been around a long time is acupuncture. But there's also a new kid on the block, which is new to the United States. It's actually been around for quite a while in Europe, but this is being called dry needling. Two completely different approaches, and honestly, I kind of thought they were trying to use acupuncture as a treatment and just bring it into the therapy field. But I've since then understood it a little better. Well, acupuncture is based on Eastern medicine. It is based on meridians, energy flow, patterns of how this energy moves through the body. And they're saying that there are 2,000 acupuncture points that are utilized in order to deal with this energy flow. And so according to the Alternative Medicine book, page 5, traditional Chinese medicine explains acupuncture as a technique for balancing the flow of energy or life force following the principles of yin and yang. And so what's very interesting about acupuncture is that for them to do an evaluation, they are actually looking at things like the shape or the coating or the color of your tongue. They're looking at the color of your face. They're looking at the strength, rhythm, and quality of the pulse. And according to a Harvard Health Publishing, acupuncture is a traditional Chinese technique that has been used for millennia to treat chronic pain and other health-related problems associated with inflammation. Yet, the scientific basis of the technique remains poorly understood. And that's just was written November 1st, 2021 by Dr. Matthew, who is an assistant professor of neurology at the Harvard Medical School. And just to kind of, I guess, give a little bit of a big different picture, or to me, a consistent picture, Dr. Chin, who's at the University of Pennsylvania, he indicates that acupuncture shouldn't be a last resort. It should be used early in your treatment journey to keep it from getting worse when it's using it to reduce your pain. And he sees that people who have tried nearly everything else to help their pain and nothing has worked, and they come to acupuncture as a last-ditch effort. And in these cases, it's often too late for acupuncture to help. Now, I honestly have an opinion why that might be the case, but again, just seeing that it's not one of those modalities that can be thrown in later into the mix of trying to work on dealing with pain. It doesn't seem to be as effective. So when we're looking at something like dry needling is based upon more of a Western approach to how we do medicine. And with dry needling, you have to be certified as a physical therapist. And this is an assessment that is quite different from acupuncture in that you look at the person's history, but a physical therapist would also look at your posture. They will look at how your body moves through motions. And much of this is really based upon your actual muscles. And there are 650 skeletal muscles. There's more muscles in your body than this, but these are the muscles that create motion, that sustain posture. And that is what the dry needling is treating. And so when the dry needling is applied, it's treating trigger points in the tissue. And trigger points are areas where I call them hot spots. They are either latent, meaning that you may not even know that they're there until someone pushes on it, or they can be very active where you are feeling pain and you know something is hurting, but you really cannot pinpoint exactly why or where the pain might be coming from. And so with the dry needling, though, it is something that you do in conjunction with other therapies. So when we look at something like trigger points, these are tightened areas of tissue. And when I find them in my patients, I say that they're rope-like. I call them ropey. I say they're guitar strings. They feel like gristle or knots. And again, there's two different types of these trigger points. And some of these you can actually learn to do some self-release, and I will be talking a little bit about some of the self-massage that you can do, but dry needling is an approach that utilizes the muscles as a part of the treatment and to break up the spasming. So when you do get dry needling, you can see or feel or sense a localized twitch. And what this does, it creates a chemical reaction that leads to an analgesic or painful, pain-releasing effect. But then also, if you are doing dry needling and you do some stretching, and every therapist is a little different, but if you do stretching after this, you can actually release the muscle. And that's kind of what we're after, no matter what. And with dry needling, it's not just one size needle that is used, because dry needling can be done from small areas of muscles in your face to the larger muscles in your thigh. Now, who shouldn't do dry needling? Anyone who is afraid of needles has a phobia. Any person who's on anticoagulants, so your blood thinners. Any person with lymphedema, which is an excessive swelling in their limbs. Anybody who has compromised immune system. The frail elderly. And anyone who has type 2 diabetes, especially in your lower extremities because of your lack of sensation. And some of the side effects of dry needling may be to feel a twitch, like I mentioned before. You might feel sore when the needle is inserted. You could get some bleeding at this place where it's pushed in. There could be soreness during the treatment, and there could be soreness after the treatment for 24 to 48 hours. Some people might have some fainting just because of maybe the reaction that they may have to the initial, being poked. Some people feel fatigued because you release chemicals when you break up muscle. Some people may have bruising, just depending on how tender their skin is. So when it comes to an option for dealing with pain, the CDC has made a statement that even the physical therapists are probably the well-positioned practitioners and very skilled to address pain in general. Okay, but they also said that they're suggesting that to use physical therapy rather than long-term or high-dose addictive painkillers to control pain. And this is a way to meet the needs of these patients in pain. And they're doing this with traditional ways of treatment and physical therapy, and then they're combining that with the alternative interventions like dry needling. So my vote here is going to be, see if you can look at doing some dry needling along with physical therapy. I think you'll find it's a very interesting experience, and it's something that I do see merit in. It does use a different kind of theories as far as what is triggering in the body, but in the clinic I have seen it do some pretty interesting changes in the tissue pretty immediately. So, and then other people, it takes several treatments. I will say probably the average is probably 6 to 8 treatments, but depending on how complicated your picture is, it could take some more. And really, for other people, it could take 3 or 4 treatments, just again, depending on how soon after your injury you're seeking for help with this particular area and spasm. So again, my name is Adina, physical therapist, and I am owner of Restored Health Solutions. And hopefully you have found some interesting information to learn about your options for treating your joint and muscle pain. Until next time.